So the Global Nursing Leadership Institute, created and designed to create a bunch of social justice warriors. That's what it's designed to do. It absolutely is. The Global Health Initiative has nothing to do with health, not when it comes to nurses and what they're doing. Yeah, no. There's so much of this you can find all over the United Nations, the Global Nurses United. It just goes on and on. But there's a couple of things that are important to know. So this goes on to say the innovative and acclaimed Global Nursing Leadership Institute is a strategic policy leadership program focused on strengthening your political and policy understanding and influence. So this is where they made their biggest mistake, these nurses. And some of them, I wonder how many on the International Nurse Council are truly nurses. They may just be radical Marxist type people that just write an RN after their name but have no background in nursing at all. It could be, really. Because radicals like this is what they do. But their biggest mistake was we don't get involved. Like, you can have your personal political opinions, right? But the minute they use the nursing profession, and they've always done this, but now they've really gotten a hold of it, and politicized it, and they did a great job of doing that with that Bonnie Costello there at National Nurses United joint. Going political, then you will drive healthcare into the ground, which they're not about helping healthcare. I don't view nurses like that as really nurses. I don't, because you're not putting patients first, you're putting your political agenda first. It is framed by nursing opportunities in a global movement committed to sustainable, unsustainable development and explores key themes that underpin the United Nations Sustainable, Unsustainable Development Goals. The GNLI, Global Nurses Leadership Institute, 2023 focuses on the United Nations Sustainable Development Goals, health disparities, and gender equity, universal healthcare, and the World Health Organization's global strategic directions for nursing and midwifery. But what's interesting is it goes on to, not this article, but there's so many you can find that I find rather disturbing. I do. So they have on the global health issues. Well, one of our global health issues is these very people themselves. This institute, along with the Global Nurses United, along with all of them that think that going global is how you're going to help. See, it is not about it. They are going to say it's about decreasing epidemics, blah, 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 all that stuff. No, it's about their social radical agenda. That's what it's about. Global health issues require global cooperation in response, planning, prevention, preparedness, and care that reflects health equity issues among nations. No, it doesn't. This is where they are completely wrong, but they're wrong in a lot of the things they say. I have no problem saying it because it's so obvious when you read it. You can, do you know how many different countries have different cultures that you can, so doing this global thing, that's why it doesn't make sense, but it's really not about health. It's about a political, radical agenda. These issues require complex interprofessional and interagency cooperation and solutions that involve governments, nonprofits, and many times include private companies and foundations. How interesting. Yeah. Private companies and foundations. More than ever, the response to the global health issues requires a broader understanding of how connected we are in today's world. No, we're not that connected. We're not that connected that we need to go global. Long before these people came along, we had a much stronger healthcare system. We did. A bunch of people, like these radicals, will tell you, no, there were all these people that nobody's ever been turned away at an ER, okay? They're using all of these things. And the reason that it's gotten worse over time, and Obamacare really just, dug it into the dirt, is because these are radical agendas. They're not about helping healthcare. They're about destroying it. And that clearly is evident by what our healthcare system used to be, that I remember it even went back when I was a nurse's aide, to what it is now. And I'm not saying that because of the people at the bedside. It's because of what the hospitals and these unions and associations got on board with and have slowly been doing over time. And while telling you it's for health and safety and, putting the patient first, it's like, how is anything that you people do ever put the... It just doesn't. So this article considers responses to issues of emerging infectious diseases, human trafficking. Can you believe that? This is the hypocrisy of these people. The absolute hypocrisy for them to even write a paper on human trafficking as if they're legit and they're at the United Nations and look at our border. And who's responsible for that? Biden and the United Nations. Unbelievable. But that's how I've said in other videos, these far left radicals, they are so radical they can't even recognize their own hypocrisy. Maternal newborn health preparedness for health inequities within a framework of social justice, equity, and maldistribution of health workers globally. What do you think that means? The maldistribution of health workers globally. Yeah. This all goes to the video I did over a month ago about last August. They all got together to talk about the nursing and migration and that kind of thing. We define and describe emerging global health issues from a nursing perspective and offer a call to action for nurses to increase awareness as global leaders. Do you ever notice these radical social justice warriors? We call for action. Yeah, no, not on board. I mean, I know there'll be a ton of nurses that'll be on board with it, but you're just being used, just saying. Of great concerns in the global health issues is the maldistribution of the healthcare workforce in terms of geography, disease, infrastructure, and resources. The global health issues occur in numerous ways and are influenced by a multitude of factors that can best be impacted by the nursing community with awareness building, focused education, nurse activation, and infrastructure support, with the nurse acting as a sentinel. And you know what a sentinel is? It's basically a political activist. That you're a warrior they're protecting nursing. Of great concern in the global health issues is the maldistribution of the healthcare workforce in terms of geography, disease, infrastructure, and resources. Yeah, I'm not sure where they're going with that, but the ability to impact global health issues depends in part on the presence of appropriate resources of all types, including human. The ability to impact global health issues depends in part on the presence of appropriate resources of all types, including human. Okay. In the next section, we will define and briefly describe the three emerging global issues. Yeah, it's all politically designed, all of it. That's what their three issues are. It's gender, it's social justice, has nothing to do with nursing, and it is why these people, global nurses leadership, are they're too stupid to see that they should not even talk about human trafficking when they align with people that are responsible for our human trafficking crisis.